So for Section 7, repairing community relationships and healing from the trauma, we will talk about collaborative solutions, interventions, and last but not least, we'll briefly talk about policy. This isn't a policy lecture, but I will mention that policy is important in order to change what we're seeing on a national level. So, the talk. When some of us, when we hear the talk, we think of this. An individual talking about the birds and the bees. But for this section, we're not talking about that talk. We're talking about the talk that African Americans parents have with their children. According to Coates, what does it mean, for instance, that black children are ritually told that any stray movement in the face of the police might result in their own killing? This is the talk that we're talking about for African Americans, where your parent, where your father, where your mother, where your grandchild has to sit you down and say that their son, when you are pulled over by police, you should do X, Y, and Z. So I put forth to the room, to the viewers today who are white, is this a talk that your parent gave you? And if it is not, why is it that African Americans in this country have to give their child this talk? Collaborative solutions. And when we think about solutions, there are many solutions that we can utilize, but what I found according to Melissa Rulin in her article, Tailoring the Police Response to People with Mental Illness to Community Characteristics in the United States, there are 10 essential elements of specialized police-based responses. Now, this was specifically tailored to those individuals who have mental health disorders. However, it can be utilized in general amongst any population. The first is a collaborative planning and implementation. Organizations and individuals affected by police encounters with people with mental illnesses work together in one or more multidisciplinary group. The purpose of these groups is to determine the response program's characteristics and guide implementation efforts. Next, design the program design, evidence-based material to address the root causes of this particular issue. Next, specialized training. All law enforcement personnel who respond to incidents in which an individual that appears to have mental illness appears to be a factor receiving training to prepare for these encounters. Those in specialized assignments receive more comprehensive training. There is a belief that many of the law enforcement officials, the officers, do not have adequate mental health training. Call taker and dispatch protocols. Call takers and dispatchers identify critical information to direct calls to the appropriate responders. Stabilization, observation, and disposition. Specialized police responders de-escalate and observe the nature of incidents in which mental illness may be a factor, using tactics focused on safety. Transportation and custodial transfer. Police responders transport and transfer custody of the person with a mental illness in a safe and sensitive manner that supports the individual's efficient access to mental health services and the officer's timely return to duty. Information exchange and confidentiality. Law enforcement and mental health personnel have a well-designed procedure governing the release and exchange of information to facilitate necessary and appropriate communication while protecting the confidentiality of community members. Number 8, treatment supports and services. Specialized police-based response programs connect individuals with mental illnesses to the appropriate community-based treatment providers and services. 9, organizational support. The law enforcement agency's policies, practice, and culture support the specialized response program and the personnel who further its goal. And last but not least, number 10, program evaluation and sustainability. Data are collected and analyzed to help demonstrate program impact and to inform modifications to the program. Now, these are some examples of things that we can do. We can work together with police, especially as it relates to individuals with mental health, but also to all population. Interventions. We have a number of interventions to treat all manner of PTSD and trauma, and these are some interventions that you will learn throughout not just this presentation, but all presentations. And they are trauma-informed care, motivational interviewing, cognitive behavioral therapy, trauma-focused cognitive behavioral therapy, psychodynamic and psychoanalytic psychotherapy, process-oriented group therapy, really teasing out the information and unpacking some of the issues that individuals are going through, mindfulness interventions of integrated treatment of complex trauma for adolescents, intergenerational trauma treatment model, and for those of us coming from a non-clinical lens, in which many of the clients that I deal with working in communities of color, we have mentoring, support groups, town hall meetings, mental health first aid training, in which I'm certified as a mental health first aid trainer, and also undoing racism training for acknowledging the racism that is happening in America, and for those of us to learn language to properly address and speak out against what we're seeing in communities and violence among communities of color. And last but not least, policy. And this is very simple in terms of policy as it results to mental health clinicians and those of us who are addressing issues of police violence. It's for hospitals, healthcare systems, accrediting bodies, and insurers should consider instituting policies that promote screening for traumatic stress, provide case management services, and educate patients about the potential symptoms of traumatic stress. And this is in particular in response to the violence that has occurred in individuals who have been abused by police officers. And that's it for this particular section. We'll move on to the final section, which is a review of this presentation. Thank you.